Thank you. Doctors?
Good morning. Thank you for joining us. Today I'm here to provide an update on Health Canada actions related to the shortage of infant and children's acetaminophen and ibuprofen products. I'm joined by Dr. Bertium and Drs. Tam and New, who will also speak to the current epidemiological situation in Canada. Let me start by saying that I understand that this is a very stressful situation for parents and caregivers. The combination of RSV, the flu, and COVID is hitting our country hard. And these medications can be very helpful in treating some of the symptoms caused by these viruses. Health Canada has been exploring all levers at its disposal to help alleviate the situation. We've been meeting with stakeholders, including manufacturers, retailers, and healthcare professionals on a weekly basis to share information and strategies to minimize the impact of this shortage. Manufacturers have ramped up production to record levels, but demand has continued to increase and significantly outpaced the supply. As a result, we've worked with manufacturers to allow access of foreign product to supplement Canada's supply. We've now received and approved 3 proposals to import foreign product, and supply has started to enter the country. After next week, more than 1 million bottles of product will have entered Canada to supply hospitals, community pharmacies, and retailers, and medications will start appearing on store shelves starting early next week. These foreign products include liquid ibuprofen for children and liquid acetaminophen for children and babies. While this is encouraging, we're continuing to identify additional sources of foreign supplies of both acetaminophen and ibuprofen, and we are assessing proposals for these supplies on a priority basis. And when Health Canada receives a proposal, we review it to ensure that the product is of the same high quality, safety, and efficacy as what we have available in the country. We also need to ensure that people will have access to critical safety information in the official language of their choice. And that includes information on ingredients, dosing, and potential side effects. Now, there have been a lot of questions about behind-the-scenes processes regarding these proposals and whether requirements for bilingual labeling have slowed access to product. I can assure you that this is not the case. And in our commitment to openness and transparency, we've created a dedicated web page on the children's acetaminophen and ibuprofen shortages. Early next week, we will be posting a table of products authorized for import, and we'll continue to update this table as we authorize more products. Now, as some of you are aware, there's also a shortage of certain formulations of amoxicillin in Canada. And while I know this is concerning, I would like to reassure you that Health Canada has been working very closely with the manufacturers, the provinces and territories, and the stakeholders, including the Canadian Pediatric Society, to assess the supply situation and discuss mitigation strategies. This includes looking at potential alternatives or foreign supply. The information gathered to date indicates that amoxicillin is available. So supply to pharmacies may be impacted here and there as measures are taken to equitably distribute inventories, but alternatives also remain available. Health Canada will continue to closely monitor the situation, including the supply of alternatives, and will not hesitate to take any action in collaboration with our partners to ensure sufficient supply and minimize any impact on patients in Canada. I'd like to conclude by acknowledging that the situation is very challenging for parents and caregivers, as well as our healthcare system. While drug shortages continue to make headlines, we are working tirelessly behind the scenes to end these shortages. It'll take time, but things will get better as we start to see the results of increased production of Canadian acetaminophen and ibuprofen products supplemented by the flow of foreign products come into the country. Thank you. Merci. Miigwech.
Bonjour. Merci de vous joindre à nous.
Hello, thank you for being with us today. I'm going to give you an update on measures adopted by Health Canada with regard to the shortage of ibuprofen and acetaminophen for children and infants. Doctors Tam and New are also here. First of all, we understand that the current situation is very stressing for parents. Coordination, the VRS, and other are affecting our country. Ibuprofen and acetaminophen are very useful for treating some of the symptoms. Health Canada uses all tools available to it to ensure a supply. We are consulting constantly retailers and suppliers to ensure an adequate supply. Manufacturers have increased production to record levels, but unfortunately, there's much more demand than we have supply for the time being. Today, we have 3 proposals for imports from foreign countries, and we are continuing to ensure an adequate supply. Next week, we will have several million doses which will be available and will be distributed to pharmacies. These products could be, again, an open sale by next week. Liquid ibuprofen and acetaminophen for infants and children. And we continue to look for additional suppliers, and we will evaluate all possibilities based on our priorities. We have proposed to ensure that the products we procure will be just as good in quality as the products already available in Canada. We will also ensure that there is labeling in both English and French. There have been many questions on the process for addressing this issue, and the possibility that the lack of bilingual packaging might hinder supply. We have created a website with regard to the shortage of acetaminophen and ibuprofen. By next week, we will have a list of products available from our imported supplies, and we will continue to search for a new supply. As many of you know, Canada has a lack of some formulations of amoxicillin. Health Canada is working closely with manufacturers, the provinces and the territories, as well as other stakeholders and the pediatric societies to ensure an adequate supply and to meet demand. We are offering solutions to address this problem, and it is still possible, however, to obtain amoxicillin. There could be some shortages in some pharmacies, but generally speaking, there is an adequate supply. That being said, there are additional solutions and possibilities for treatment. And we are working in close cooperation with our partners to minimize the effects of this shortage. And we know that the current situation is very difficult for parents and for caregivers and for the health system. But with these efforts and continued collaboration with our partners, we will address this issue, and we are starting to see the results of increased production in coming weeks. And that will be added to the import of foreign products. Thank you, Dr. Tam.
Merci and bonjour à toutes et à tous.
Thank you. Hello, everyone.
There is continued variability regionally and across COVID-19 activity indicators, including case counts, percent positivity, and wastewater signals. SARS-CoV-2 virus is still circulating across the country, while other respiratory virus activity, including influenza and respiratory syncytial virus, or RSV, is above expected levels for this time of the year. At the national level, lab test positivity is at near 8% for RSV and 16% for influenza. Both of these viruses are having a large impact on children, and the proportion of influenza detections among children and teenagers is unusually high. As a result, a number of pediatric hospitals across the country have reported unprecedented levels of viral respiratory infection-related ER visits and admissions. While we don't have a vaccine for RSV yet, there are vaccines available to protect children aged 6 months or older from severe illness due to influenza. Getting kids vaccinated with the vaccines we have available for them is an important measure we can take to protect them from severe illness. In addition, to get vaccinated as a strong foundation of protection against severe illness, using personal protective measures is also particularly important at this time. Using layers of protection like wearing a good quality, well-fitted face mask and frequent hand washing not only help to protect you, but also help reduce overall spread. It is also really important to stay home when you're sick to help reduce the chances of infecting others. One of the biggest challenges of having multiple respiratory viruses circulating at the same time is the large and sudden surge of illnesses that can overwhelm the health system. It also means that there's a lot of virus circulating in the community, so we may be more likely to encounter viruses as we interact with each other in schools, workplaces, and social settings, especially indoors, and if masks are not being worn. This is why our Vaccine Plus approach is so important right now. Although no individual layer of protection is perfect, when used consistently and together, Vaccine Plus layers can provide very good protection against COVID-19, as well as many other infectious diseases we may encounter. Thank you. Merci. Miigwech.
Bonjour à toutes et à tous.
Hello, everyone. At the national level, the different indicators for COVID, the percentage of positive tests varies constantly, and these variations are also noted at the regional level. The RSV is still present across the country, and there are also influenza and COVID. The levels are higher than we would expect at this time of year. At the national level, positive tests is almost 8% for RSV and 6% for influenza. This has a disproportionate effect on children and infants, and the levels for adults and adolescents are also higher. As a result, some hospitals, pediatric hospitals, have reported unprecedented numbers of visits to emergency rooms and to hospitalization for respiratory problems. There is no vaccine yet against RSV, but there are vaccines to prevent serious problems by influenza virus for infants. They are accessible, and this is an important measure that we can take to protect infants from serious illness. In addition to vaccination to protect against serious illness, the adoption of protection measures by individuals is also particularly important at this time. The use of protective measures like wearing a mask, a good quality mask, well adjusted to your face, and washing hands is a good measure to protect you and to avoid spreading disease. It is also extremely important to stay at home when you are feeling ill in order to help reduce the risk of contaminated other people. One of the greatest problems associated with the simultaneous presence of these various pathogens is that the caseload can submerge the hospital system. And there are also children who are more, and individuals who are more susceptible to exposure to these illnesses by presence in schools and in other crowded spaces without wearing of masks. So the use of protective measures is so important at this time. Even if individual protection measures are not perfect, used constantly, continually, with the use of vaccination can provide excellent protection against COVID-19 and many other infectious illnesses that we can be exposed to. Thank you very much.
Okay, let's move to questions. We'll begin with Catherine Levesque with National Post.
Yes, hi. Hello, doctors. I have a few questions. I'll try to cram them all in. First of all, about the, for Dr. Sharma, probably for the 1 million bottles that we're expecting early next week. Dr. Berthiaume did say that they're going to hospitals, pharmacies, but also retail stores. I was wondering if you can maybe give some sort of breakdown as to how many we're Health Canada is expecting to distribute at each of these categories, and also where are these this medication coming from which country?
So in terms of there's different supplies. There's supplies that are coming into hospitals of ibuprofen and acetaminophen, and then the initial supplies included in those 1 million bottles is of acetaminophen for children, and those are the products that are destined for the pharmacies and the retailers. We're still finalizing all the numbers and when they're coming in, and we'll be putting up aggregate numbers next week. But the important part of it is that there's already product that's in the country for the hospitals. So that's already started distribution. And we're finding that in the hospitals, their supply seems to be quite stable now. But, understanding that out in the community, people are looking for when they'll start seeing products out on shelves. And that's the product that is now in the country. So the acetaminophen for consumers and retailers is in the country, and then will start to be distributed early next week. And then there'll be information around, as we said, on the website, on the overall products that are coming in, but also on the shelves. When people are going to get products, there'll be information. So if you see product that might be a little bit unfamiliar to you, a little bit different, there'll be information including tear sheets, QR codes, and identifiers for the product that's foreign product.
Thank you. And so in committee, you did say that Health Canada has been aware of this shortage since April, and we understand some measures were taken at the time. But I think a lot of Canadians are wondering, why did it take so long for Canada to actually import products from elsewhere? And are there any lessons learned in all this?
Yeah, certainly with respect to shortages, overall, each shortage is a bit different. So we really manage it on a case-by-case basis. And it's true, we started to see some reports of shortages in these products back in April, and went out to the manufacturers and the distributors and other stakeholders in the community to get a better sense of what the demand would be, what the supply situation looked like, and all of the options were on the table. So, including the potential for bringing in foreign supply. But earlier on, when the supply was a bit tight, the manufacturers felt that by ramping up the supply, that they would be able to meet demand. And that continued until, late summer, early fall, when that increased supply. And just to give you an idea, so if we're looking at production of both those products, both the acetaminophen and the ibuprofen now compared to last year, just the production of the product that's already authorized for Canada is double what we would have seen last year. But that was still not enough to meet demand. So it was really late summer, early fall when the use of the foreign product importation, the exceptional importation, really came into play. And then the companies came forward with proposals. Health Canada looked at them very quickly, and then product has started to flow. So it's been basically continuing. The activity has not let up. We've been very active on the file since the spring. But in terms of when the need for foreign product was coming into play, again, the possibility was always on the table, but it was really taken up just in the last few months.
Moving to Raymond Filion, TVA.
Raymond Filion, TVA.
Bonjour.
Hello. Many parents try to go to the US to get products. How is it that the United States doesn't seem to have been affected by these shortages? Currently, the situation in Canada is a bit particular in the sense that we see a strong increase in influenza and as well as COVID-19 that has persisted. And that means that there's been an ongoing demand for acetaminophen and ibuprofen. I can't really tell you about the medical situation in the US, but generally speaking, peaking in Canada in the spring. These products are less in demand, and companies can rebuild their stocks. But this year, because of COVID, there's been an ongoing demand for these products, and now we can see that in the fall we have a much greater demand with the presence of flu and RSV. And we've just heard that the production has doubled in Canada, but it hasn't been enough to meet this exceptional demand. And we have looked at other solutions, so I can't really comment on the situation in the United States. But in Canada, measures have been taken right from the beginning to ensure adequate supply. We've worked with manufacturers to double their production in Canada, and despite that, there has been so much demand in Canada, and I can't really say what the situation is in Canada, just in the US, but in Canada we have a very unusual situation due to the epidemiological factors, and we have adopted many measures to meet demand, and therefore we are going to import 1 million doses of acetaminophen for use in Canada to provide parents with the option of these medications. So 1 million doses or 1 million bottles, and to the extent that this very high demand created supply problems, should there be measures to control the sale of these products, for example? To be clear, it's 1 million bottles that will be imported into Canada, and so one bottle, I mean, and with regard to the distribution, each province can adopt measures, or each pharmacy can adopt a measure to control access to the medications. And with regard to availability, we have to look at what options are available. Some pharmacies, for example, might compound products or offer alternative products individually, and that's not always available in all pharmacies, and the situation can vary from province to province and pharmacy to pharmacy.
Kevin Gallagher, CTV.
Hello, I'd like to follow up on Ray's question, but in English. It's puzzling to me. So why, I mean, RSV, the flu, and COVID are also hitting the United States, but there doesn't seem to be the same type of acute pharmaceutical shortages in that country. So why is this hitting Canada especially hard? Beyond just acetaminophen, you have 800 drugs in short supply.
Well, certainly the issue of drug shortages in general is something that is global. So there are, a number, we're working internationally. There's actually a whole international group of regulators that are focused just on drug shortages, and Canada chairs that. So it's been something that we've been dealing with for the last 10 to 15 years. So certainly it's not unique to Canada in terms of the general sense of drug shortages. And what we see with drug shortages is that they can be different from country to country, depending on the supply situation and the demand situation. In terms of the United States, while we can't sort of speak specifically to what's happening, we know that there is some tightness in supply as well. But in Canada, what we saw was that there was a progression, and there was a bit of a perfect storm coming through the end of the spring and into the summer, where we had increased demand at a time where we did not typically see that increased demand. And then that's the time that the companies would normally be replenishing stocks and then moving forward to get ready for the fall and the winter season. So they didn't have the opportunity to do that. And then there was another increase in demand. So that seems to be a bit particular to Canada in terms of that late push in summer. And so that's probably why we're feeling it a bit more there. But certainly even in the United States, there have been reports of intermittent stockouts or having some challenges to find some of the products on shelves as well. So I wouldn't say that it's completely, not an issue in the United States.
And as far as the supply that's coming to Canada, are there specific numbers that you can give Canadians to allay concerns that there are of these supply shortages? What are the specific numbers in terms of acetaminophen or other types of drugs? You mentioned as well amoxicillin, so antibiotics. Are parents also going to have to be worried about a shortage of antibiotics, including on top of the shortage of ibuprofen and acetaminophen?
Yeah. I mean, in terms of our definition of what a shortage is, it's very broad. So it's any sort of limitations. And so when you see on the Health Canada website, the numbers of shortages that are reported, the vast majority of those don't reach what we call tier 3. So that people don't even see them or don't feel them. There are numbers, a smaller number. So there's about 20 shortages right now that have impact in terms of access in Canada. Manage those on a case-by-case basis, as we've said. So what we would say is that, certainly the issue with the acetaminophen and the ibuprofen is acute, and that's why we're bringing in foreign product. That's why manufacturers have doubled their production to be able to try to meet that. I think we're still going to be working through that for a period of time. With respect to the amoxicillin, as an example of a product that's a bit different, it's an antibiotic. It's by prescription. So the way that that's dispensed or the way that it's accessed is a bit different. And as well, there are alternatives. So, although there's a shortage, there are some formulations that are available. It's not in as tight a supply as we're seeing with the ibuprofen and acetaminophen, and there are some alternatives. So we manage each of those. I think what I would want to make sure that people know is that this is something that goes on in terms of shortages in the background all over the world. And there's a whole team that's working on each of them and to try to mitigate that or decrease any impact as much as possible. And every shortage is, as we said, slightly different. So we look at all the different strategies that we can bring to bear to try to minimize any of those impacts. So we don't want people to. Well, obviously, people are concerned, and we really sympathize with what everybody is dealing with. It's hard enough being a parent and having young children and having them sick, but having to worry about getting medications is added stress. But for the vast majority of these shortages that you're seeing, we're managing them, and people won't actually even see them at the pharmacy or the retailer.
Okay, Kate Allen with Toronto Star. Kate Allen, Toronto Star.
Hi. Has Health Canada figured out what number of bottles of children's painkillers will be necessary to import to alleviate the shortage, and what is that number?
So it's basically looking at what the demand is. And with these products, it's more challenging to estimate demand than for, like if you have a product that's a prescription medication, it's treated for a specific disease and it's taken every day, twice a day, it's quite easy or easier to estimate what your demand is going to be. With these products, both for acetaminophen and ibuprofen, they're used for a range of different conditions. So fever can be caused by a lot of different things, different types of infections, different inflammation, other things as well. Also, they're used for pain. So it's really depending on what the demand might be. And as we said, we've been tracking it, but the demand has been very atypical over these last few months. So what we do is that we continue to track it. We're working really closely directly with retailers to find out where supply is, what kind of volumes they're seeing in terms of sales. We look at comparisons to previous years just as a bit of a guideline. But what we know now is that there has been a shortage. Obviously, it's to the point where it's critical. And what we're doing is we're bringing in as much product as we can in terms of availability. The 1 million bottles that we're talking about are the products that are coming in that are either already in the country or will start to be seen next week. We're also having discussions with manufacturers about bringing in additional supplies, additional formulations. So it's something that we're going to keep talking about. And then we'll see what happens in terms of the supply that goes out there, how quickly it's taken up, what the supply situation is, and then we continually reassess that. So it's just very challenging to predict.
Is there a follow-up, Kate? Okay, we'll move to Miranda Leborn, Branson Son.
Thank you. My question is, I've heard some concern in rural areas of Canada that the major cities are going to be prioritized with these supplies first in hospitals and in pharmacies and drugstores. And so I'm just wondering, what scale or how that's going to be distributed and what rural Canadians can expect in the smaller communities. Thank you.
Sure. So in terms of the Health Canada role, we're aware of that, and we want to make sure that product is distributed equitably, and it really goes to where the need is. So that's why we work directly with the manufacturers and the retailers, and bring them together with the provinces and territories. And the idea is that we want to make sure that the product is used responsibly, and that it's being conserved. The supply that we have is being conserved as much as possible. And those conversations include making sure that product reaches rural and remote and northern regions where we know that there may be more difficulties accessing health services, for example, or people have to travel distances to travel to access health services. And as well, a lot of the manufacturers and the distributors have direct relationships with, for example, nursing stations in some of those areas. So I know there's been speculation that product will go initially to cities. I think what sometimes drives that is that often you'll see product appear first in certain places, and that's just a factor of how close those places are to where the distribution centers are. They tend to be in larger places, but certainly we're doing everything that we can to make sure that product is going where there is most need. And as we said, that includes special considerations for rural and remote regions.
And just to follow up, if at all possible, we do know that some communities in Canada, such as Indigenous communities and reserves, they do struggle with a little bit higher numbers of some illnesses. Is there any special consideration being given to Indigenous communities when it comes to getting them the medicine they need?
Yeah, absolutely. So we're working with our Indigenous Service colleagues, Indigenous Service Canada colleagues, as well as those in the provinces and territories. And when I was talking about rural and remote areas, that's also included in the conversations about First Nations, Inuit, and Métis communities, and where they may be seeing either increased demand or have supply issues, or potentially because of their circumstances require access to more products. So that's absolutely part of the conversations that are happening.
Thank you so much.
Okay, we will try again with Marie-Josée Paquette, Radio-Canada.
Oui, est-ce qu'on m'entend bien?
Can you hear me?
Bonjour, est-ce qu'on m'entend bien?
Can you hear me?
Oui. Oui, d'accord, merci beaucoup.
Yes.
Alors, tout d'abord,
So first of all, I'd like to
une question par rapport aux fournisseurs.
with regard to
expliquez-vous que les fournisseurs
suppliers,
leur capacité de fabrication seulement cet
how do you
quand la demande n'avait pas baissé l'été comme à l'habitude?
how can you be sure that supply has been doubled when demand has continued to increase? And has the government failed in its role in predicting need and also in requiring companies to increase production? First of all, as I said, that the work started right from April with companies to increase production, and for the products improved in Canada. Of course, there is a gradual increase in production. It doesn't happen overnight. But these efforts started already in April, and it was more towards the end of summer and beginning of autumn that we could see that despite the doubling in production, there was still not enough supply. And we decided to go to outside the country, and we are working to use all sources to increase supply, including from outside Canada. And we've adopted measures, and you have to understand the exceptional character of this high demand and the intensive demand for medication and the workload for pediatric hospitals and pediatricians. The fact that there is such a high demand means that despite the increase in production and importing of products, there continues to be a very tight supply. We continue to receive new supply, and the situation of combination of this very much higher than usual demand, as well as supply chain problems. And we, in a normal situation, more normal situation, would have more than adequate supplies. We have asked, of course, the companies, and they have targeted production, increased production, and we're working with suppliers to increase supply. We've constantly worked on these measures, and the current situation is the combination of various illnesses, and it means that we have had to find many different avenues for responding to the problem. My next question, do you have any influence or suggestions with regard to domestic production of these products? And how many products, and what is the situation? How much is produced in Canada, and can that be a solution for the supply? Health Canada works with a number of partners, the manufacturers, also retailers, and with health professionals to study the situation as it evolves and to ensure supplies of medication together. It's a very complex situation. There are 10 manufacturers in Canada and hundreds of products that are available specifically for children. And this is the overall demand. As it increases, this places a load on the system, and we work with our partners to ensure supply. We've said this is a very exceptional situation, and we started working to ensure supply very early. National production, domestic production has doubled, and we are constantly monitoring the situation, the demand, and trying to predict future demand. But it's not an easy thing to do. There are a number of factors, and we have to, given the historical highs in demand and these multiple illnesses, normally demand is much less than what we're seeing now. And we will have to continue to adapt and find solutions. But these are things that we continue to monitor, and we continue to work with our partners like providers, manufacturers, to ensure an adequate response.
We'll circle back to Kate Allen, Toronto Star, for the final question.
Hi there. You mentioned that future shipments might include formulations that are new to Canadian consumers, and I'm wondering if you're concerned about parents or caregivers making dosing errors as they try to convert, from amounts they're familiar with to ones they're unfamiliar with, and what Health Canada is going to do to try to prevent that. And secondly, I don't think I've heard yet the number of that 1 million that's headed for pharmacy shelves that parents can actually access themselves. I think parents would really like to get that number if possible.
Sure. So to start with the product, so when we're looking at in a shortage situation and we look at what we call exceptional importation or bringing in the foreign product, what we look first is a product that is actually very similar to a Canadian product. So if it's similar in terms of what the product actually is, how it's used, what the dosing is, that's preferable. But what's really important is that if we're bringing in any product, is that Canadians have the information that they can use to be able to dose it appropriately. And so that's why we worked with the manufacturers for any of the product that comes in. There will be, when you go to the pharmacy or the retailer, what we call shelf talkers, so information that's identifying that product as the foreign product. There's written information to talk about the dosing and how to use it, the appropriate use. So I think there's two things that, regardless of what the product is really important: is read the label and read the dosing. And for children, one of the other things I would say is make sure that you know that you have you weigh your kid. Make sure that you know the weight, because a lot of these products are based on weight. And although they're very safe, but if overdosed, both the acetaminophen and the ibuprofen can have serious side effects. So on the acetaminophen side, an overdose can lead to severe liver effects. On the ibuprofen side, there can be things like stomach bleeds and things as well. So I think it's really important, regardless of the product, whether it's a product that's authorized in Canada already, or if it's foreign labeled product, that you would want to make sure that you read those dosing instructions. But the product that's coming in, just to say, for these first shipments, is actually very similar or almost exactly the same as the product that's already authorized in Canada in terms of formulation. So just verify that, but there should not be differences. If we are bringing in product that is quite different, so if it's different in concentration or different in dosing, then that'll also be indicated in terms of all the information that goes along with the product. And in terms of the specific numbers, as we said, we've got aggregate numbers, now we've got overall numbers, and we're working at getting more specific numbers, but also to make sure that it's something that we can put that number in context. So just to give you an example on the bottle, some of the bottles that are coming in, the foreign product is actually a different number of doses per bottles or different volume than the products that we have. So we want to make sure that if they're sharing any numbers, that there's actually some context that's put to it, and that we can have those discussions. But that's why we're sort of talking about in the overall that we've already got a base where we've had manufacturers including, increasing their production. So we've already got double the normal supply of the Canadian authorized product that's out there, as well as the million bottles that will start coming in for the retailers, but have already started coming into Canada.
That's all the time the doctors have. I do have two other questions that have popped up. If there is a couple of extra minutes, can we proceed? Or
sure, we can take a couple.
Okay, so we'll go to Jordan Olmsted, Canadian Press.
Hello. I'm wondering if you know whether fewer kids have been vaccinated against the flu this year compared to previous years, and what some of the barriers to that are, and what you plan to do about it.
Hello, this is Teresa Tam. No, I don't have that information. The provinces obviously are, responsible for that. We don't, unlike, of course, COVID, we have very regular reporting, given the capacity for reporting that's been built over the last couple of years. But I do think that this is a great opportunity, not only for kids, but anyone 6 months or older. So first of all, protecting the kids themselves, but the adults around children could also be vaccinated and have the other added layers of protection to reduce transmission to their younger family members. The other thing that I would say is generally in Canada, uptake is the highest in the seniors and those with underlying medical conditions. So there's always room to increase vaccine uptake in the very young, particularly. One thing I would also add is that often what we see is, of course, increased viral transmission in the pediatric age group, which then translates to increased activity in the older age group. That could be coming next, and we need to protect our seniors, our long-term care facilities who have, of course, been through a really difficult time in the last 2 to 3 years.
Just a quick follow-up, if I can, just on the question of acetaminophen and ibuprofen. Where is the active ingredient in Canada's supply produced? And if it's not produced domestically, what can we do to try and improve that production?
So just to say, in terms of acetaminophen and ibuprofen, we have 10 manufacturers of the products and about 31 different products. 2 of those manufacturers also manufacture active pharmaceutical ingredients. So there's a big variation. So some of the active pharmaceutical ingredients, they come from different countries. So we don't have the specifics, but we're having discussions in terms of, production overall, in terms of our approach to life sciences and pharmaceutical manufacturing, about augmenting and increasing domestic production, not only of active pharmaceutical ingredients, but also of the finished dosage product. So that's an active conversation. But like I said, there's lots of manufacturers and lots of different products, and the sourcing of those ingredients are from a variety of different places.
We'll try the last question. Marie Chabot-Johnson with Radio Canada.
Bonjour, c'est vraiment simplement
Hello.
Une question
This is a question,
de précision.
just a detail.
Si on voulait
If
être capable de subvenir à nos besoins en
we
termes
want to meet
d'analgésiques,
our needs for
seulement au Canada,
analgesics,
la question qu'on se demande, c'est
just from Canadian sources.
c'est quoi
Normally,
notre capacité
what
au
is
Canada? C'est quoi
our
notre
capacity
utilisation
in
au Canada de
Canada
façon normale? Et cette année,
in normal
c'est
times?
quoi l'utilisation qu'il aurait fallu avoir en fait pour pouvoir combler le besoin?
And what can be done
pour
to
éviter la pénurie?
meet the needs faced with this situation?
En termes de chiffres.
Évidemment, c'est difficile
It's difficult to predict. I think traditionally there is production in Canada that met our needs, but this was doubled and still didn't meet the need in the current situation. And given the exceptional nature of this situation, and maybe next year or in coming years, the situation will be relatively stable. And it's difficult to predict what the need will be from year to year, and there's the 3 different illnesses that are circulating, but we can't really predict what might be needed in the future. What we can do is define what is the need now and meet that need. And in the future, we can try to analyze what products are available and how we can ensure that we could meet any likely scenario. But we've never in the past had such a demand on or demand for these products in Canada before. And this is kind of a perfect storm situation where we have the three viral infections that are circulating, and this means there's an enormous demand for these analgesics, but maybe something very different next year. And we can use the experience of this year to make our system better. But like I say, starting in April already, in the spring, and then into the fall, we started working on this and increasing our efforts based on the increase in demand. And adjusting our supply, and it's really, as I said, a perfect storm, and we're taking exceptional measures to respond to the situation, and in coming years, it may be quite different. And we're working to respond as supply, as demand increases, and we're doing everything we can. My question was, if we have this normal
Là, je comprends qu'on l'a doublé, là, mais dans les années précédentes, normalement, elle est de combien notre capacité?
Analysis of our usual needs. Can we ensure that we always have an adequate supply? It's very difficult to answer that kind of a question because when there's a product and many of these products, I mean, you can different doses, different levels of doses. But you said you've doubled production, though. Yes, that's in our discussions with the distributors and the manufacturers. We've ensured that everything that could be done to increase supply was done. But since there was such an exceptional demand for these products, and starting in April, we started working on ensuring that production would be increased to meet the demand as it increased. And we consulted the manufacturers, and then we started to look for additional supplies. Yes, but that's what I'm asking for in general. What is the need, generally speaking, and how can we ensure a supply? Marc, can I just add something in English?
Marie, oui, est-ce que je vais ajouter en anglais?
Is it okay if I speak in English?
Si vous êtes plus à l'aise en anglais, allez-y.
Oui, je vais essayer, mais c'est un moyen d'utilisation de deux produits. Donc,
there's an average use for ibuprofen, acetaminophen for infants and young children. It's 500,000 to 600,000 units. Whether it's bottles or tubes, but this is the average. So the change from a month to another, then 1 month to another can be different, and that's why we talk about a 2-month production period or a definite period, and we compare these periods with the use and the demand in another in a preceding year, for example.
Thank you very much. That concludes today's press conference. Thanks for taking the extra questions.
Good morning. Thank you for joining us. Today I'm here to provide an update on Health Canada actions related to the shortage of infant and children's acetaminophen and ibuprofen products. I'm joined by Dr. Bertillon and Drs. Tam and New, who will also speak to the current epidemiological situation in Canada. Let me start by saying that I understand that this is a very stressful situation for parents and caregivers. The combination of RSV, the flu, and COVID is hitting our country hard, and these medications can be very helpful in treating some of the symptoms caused by these viruses. Health Canada has been exploring all levers at its disposal to help alleviate the situation. We are assessing proposals for these supplies on a priority basis. And when Health Canada receives a proposal, we review it to ensure that the product is of the same high quality, safety, and efficacy as what we have available in the country. We also need to ensure that people will have access to critical safety information in the official language of their choice. And that includes information on ingredients, but things will get better as we start to see the results of increased production of Canadian acetaminophen and ibuprofen products, supplemented by the flow of foreign products come into the country. Thank you. Merci. Miigwech.
Bonjour. Merci de vous joindre à nous aujourd'hui. Je vais vous mettre à jour sur les mesures prises par Santé Canada à l'égard de la pénurie d'ibuprofène et d'acetaminophen pour enfants et nourrissons. La Dr. Tam et le Dr. Mou sont là aussi pour parler de la situation épidémiologique actuelle au Canada. Permettez-moi d'abandonner, y compris des fabricants, des détaillants et des professionnels de la santé, pour échanger des informations et des stratégies pour minimiser les conséquences de la pénurie. Les fabricants ont augmenté leur production pour atteindre des niveaux records, mais la demande a continué de croître et a grandement dépassé l'offre. Nous avons donc collaboré avec des fabricants afin d'autoriser l'accès à des produits étrangers qui compléteront l'approvisionnement. Comme certains d'entre vous le savent, le Canada connaît une pénurie de certaines préparations d'amoxicilline. Je sais que cela est inquiétant. Cela dit, je tiens à vous assurer que Santé Canada travaille en étroite collaboration avec les fabricants, les provinces et territoires, ainsi que des intervenants, dont la Société canadienne de pédiatrie, afin d'évaluer la situation de l'approvisionnement et de discuter des stratégies d'atténuation. Nous étudions notamment de possibles solutions de rechange, qui sont actuelles et très difficiles pour les parents et les proches aidants, ainsi que pour notre système de santé. Bien que la pénurie de médicaments continue de faire les manchettes, nous travaillons sans relâche en coulisses pour y mettre fin. Cela va prendre du temps, mais les choses vont aller en s'améliorant quand nous commencerons à voir les résultats de la production accrue de produits contenant de l'acetaminophen et de l'ibuprofène au Canada, à laquelle s'ajoutera l'importation des produits étrangers. Merci. Maintenant, à vous, Dr. Tam.
Merci et bonjour à toutes et à tous.